when a body is exposed for a prolonged period of time to the extreme heat conditions of the environment, whether indoor or outdoor environment, there can be problems related to health, and these problems can lead to disaster, or they can lead to emergencies which may need urgent medical help in addition to the first aid which is being provided at the site of the victim. And as we also know that the responsible factors or the predisposing factors for such conditions could be newborns, could be infants, the young children, very old people having major problems of physiological and physical problems, also the patients who had some drugs, who are on drug administration, patients with diabetes and other cardiovascular disease and so on and so forth. These patients are more prone to get adverse effects of exposure to heat, and the temperature may vary from person to person depending upon the threshold of the temperature. And as a first aid care provider, you have to be very vigilant in identifying and recognizing the signs and symptoms, and also the level of the heat exhaustion or heat stroke or the sunburn which has happened to the patient, the symptoms which the patient is depicting, and the responsiveness of the patient, because the responsiveness of patient will enable you to provide the proper first aid care to the patient and also send the casualty to the particular type of care depending upon the assessment of the patient at the site of the emergency or at the site of this. Some of the conditions which could be which can be as a result of heat exhaustion or heat climatic condition could be heat cramps, they could be heat exhaustion, heat stroke, sunburn, hypothermia and dehydration. When you know about these problems, then only you will be able to provide them the first aid. Ms. Soni, can you tell us about what are the heat cramps? Because basically it's a very, very simple form of heat exhaustion. We can say that when the body gets cramps, that there may be stomach cramps, there may be cramps in the legs, there may be cramps in somewhere in any other parts of the body, which the person will not realize that this has happened because of the heat, because of the prolonged exposure to heat. So they need to be educated that the heat can lead to the cramps in the body, which is at the minimal level, not at the level of sunstroke or at the level of sunburn. So what are some of the signs and symptoms which a first aid provider should identify?
Heat cramps are the cramps, contractions or spasms which occur because of the exposure to extreme heat or hot environmental condition, and it is as already told by you ma'am, it is a mild form of heat related emergency. So what are the causes and recognition of the heat cramps? The basic cause of heat cramps is when you are exposed to extreme heat or mild kind of heat and you are working outside in an outside environment. It is very common in hot weather for the people who work hard or do strenuous exercise outside in the sun, or when they are sweating a lot. Small children, older people, overweight people and people who have been drinking alcohol are more prone to this kind of heat cramps. But what is the major cause is that when you sweat more, you lose the valuable electrolytes and water from the body, as a result of which your body may feel cramped. And how will you recognize it? Obviously, the victim will tell you about the history of cramps, muscle pain, tightness in the muscles. The skin may over the time turn red. They may also tell you that they have been sweating heavily and they are feeling very, very thirsty. There may be fatigue, tiredness, dizziness and fainting. Now, what is the first aid that you will do? As already told you, the cause is that electrolytes and water has been lost, so that is what you have to give to the victim. That is what you have to replenish. So what is that? You have to move the victim to a cooler place. You have to make him rest and you have to give him fluids. Obviously, in this kind of condition, the victim will not become unconscious. He will tell you that he is having these problems. So you can give him energy drinks, or if they are not available, 1 teaspoon of salt in a liter of water, and then he can be made to drink it. One can also add little sugar and lime juice to the drink. You can massage the affected muscles and gently stretch them. Apply moist towels, that is towels which have been dipped in water and then squeezed, or you can also use covered ice packs to the forehead and cramp muscles if they are available. And if the problem persists, you have to seek medical help. What you have to do is that you have to monitor the area properly to find out the status, because you have to monitor the victim whether actually he is recovering or he is going into deeper form of heat related emergency, which can be heat exhaustion or heat stroke over the time. You have to tell the victim to stop any kind of strenuous activity, especially outside in the sun. Tell him to go and rest, and it will be suitable if he is outside in shady and cool place, and if it's possible in his home in a cooler area. You don't have to give anything to drink if nausea and vomiting is present. If he is feeling nausea and he feels like vomiting, don't give. Wait. If he feels okay, then you give the fluids. Don't wet the victim and don't pour water on the cramped muscles. If this does not become well, then you have to take the victim to medical facility, because in many cases the victim may be suffering from heat exhaustion and he may require another intervention, that is intravenous fluids. But that you will not be able to determine. Based upon the history and his problems, you may and can take him to medical facility if the things do not improve over certain days. And if the victim does not improve, obviously over the time he may go into heat exhaustion, which is the second kind of problem. Heat exhaustion is a heat related illness and a heat related emergency, which occurs when you are exposed to high temperatures, which causes the body temperature to rise, which is a mild rise but less than 40 degrees Celsius. You have to take care of the victim at that point. It occurs when body is not directly directing the blood supply to the skin for cooling. So some kind of disequilibrium has already occurred in the body. As already ma'am has told you, hypothalamus is the heat regulating mechanism in the body. So something has gone wrong in that heat regulating mechanism. It's not able to regulate, but the temperature is not very high, but it is also not very low. So you have to take care of the victim, and thus you can simply say that it is a condition where the body has become overheated and there is lot of sweating. What are the causes and how you will recognize it? The cause is, it is related to loss of water and salt from the body. As already told, this also happens in heat cramps. But here the sweating becomes more excessive and the body temperature also rises. It occurs when there is exposure to high temperature, like highly humid weather or environmental conditions occur where there is no circulating air to cool the body. So that is the kind of how do we relate with our traditional language. Then recognition. Body temperature is between 98.6 degree Fahrenheit and below 104 degree Fahrenheit. So it's below 40 degrees Celsius, but it is above 37 degrees Celsius. So it's a mild, little more moderate kind of heat emergency. Cool, moist, pale skin, lot of sweating is there. That is one of the major point you have to take care of. Heat cramps also have sweating. The heat exhaustion has lot of sweating. So there is loss of lot of important fluids from the body. As a result, he may feel faint, dizzy, fast pulse, muscle cramps, headache, tiredness, nausea and vomiting. There may be also presence of diarrhea. So what you have to do in the first aid? Reassure him. Move him to a cold shady place, and you have to lift the legs up to 20 or 30 centimeters so that the blood rushes back to major organs of the body, that is back to heart and back to the brain. Loosen his or her tight clothing. If it is possible, you can make him bathe also. If it is not possible, you have to cool him by fanning and using wet towels on face, neck, chest, hands and feet. You have to provide plenty of water with a pinch of salt and transfer to the nearby hospital if problem persists. What you have to do is that you have to monitor properly, avoid any kind of strenuous activity immediately. Give him nothing by mouth if he is unconscious. You have to massage any cramped muscles if needed. While you give the fluid, make the victim sit and see that he is fully responsible and tell him to drink the water slowly. Water you may add, like in heat cramps you have added juice, lemon juice, and you have added sugar and salt. In this case you can also add this, and it is better if you give such a fluid to the victim. But if the victim feels nauseous and vomiting, as already told in heat cramps also, don't give him anything. If he is unconscious, don't give him anything. Don't wet the victim and don't pour water on the cramped muscles. This is very important. You don't have to flush the victim. You just have to make him take bath, and then you have to cover him up properly and then take him out. Don't give coffee or tea. Don't give fatty or oily foods because he will not be able to digest it at that time. Give any kind of fluids if they are available, and small meals over the time which are semi-solid in nature. Then the next is heat stroke. It is one of the major kind of heat emergency. So you can see that first there will be a mild form, that is heat cramps. There is moderate form, that is heat exhaustion. Now there is a more severe form, which is heat stroke. It is also called as sunstroke, and it is acute and a serious emergency in which the body's temperature rises above 40 degrees Celsius and the body cannot control its temperature by sweating. So heat regulating mechanism actually fails in this case. So what is the difference between heat exhaustion and heat stroke is that in heat exhaustion there is moist clammy skin, and because the victim is sweating a lot, and normal or subnormal temperature, that is below 40 degrees Celsius. In this very high body temperature and the body will be dry and hot, the skin is there will be no sweating. So it is a severe form of heat exhaustion and you have to take care of this. What are the causes? When the environmental temperature is high in summer, the body overheats, victim becomes dehydrated, body's water level goes down and it is not there to sweat. So sweating is very important if you have to control and manage the body temperature. When this does not occur, the body's heat regulating system goes down. So most of the heat related deaths occur in elderly because their circulatory system is not able to compensate the stress which is caused by heat, and they have decreased ability to sweat. So what happens is there is high body temperature, skin is very red, hot and dry, no sweating. So that is the basic difference between heat exhaustion and heat stroke. Fast heart rate, confusion, fainting, heat cramps, headache, nausea, vomiting, person may become unconscious. So what is the first aid in stroke? You have to move the victim to shady and cool place. It is what you do in case of heat exhaustion, same you have to do. But if a large source of water is available, you can immerse the victim in the water, which you should not do in case of heat exhaustion. But in heat stroke, you can do that. You can immerse him, like if suppose tub is available or a big water area is available, pond is available in the rural areas, you can immerse the victim. If that is not there, you can apply cold water sheet and pour water on the victim as seen in the figure. The ice packs can be applied to neck, armpits, groin and raise the feet to keep him in fan so that his body temperature gets down and he becomes cooler. You keep on monitoring the temperature, and in case the monitoring the body temperature rises again, you repeat the above steps. And if your steps are failing, the body is not responding, that is his temperature is not falling down, please take him to medical facility immediately. So what are the do's and don'ts you have to do? Monitor the victim properly. If he is conscious and temperature is lowered, give water, but check there is no nausea and vomiting. If the victim becomes unconscious, please do resuscitation. Lose any kind of constructive clothes and jewelry. While giving fluid, make him sit, just like in heat exhaustion, and see that he feels responsible. Don'ts, that is what you don't have to do, is that do not give coffee and tea because these are diuretics. Actually, they cause the water to be get out of the body through urine. But we want the body to have it go, we want the water in the body because we want it to go through the sweating. We want to regulate the body's heat by this. Don't immerse the victim in ice. Only water. That is only plain bathing water. Don't give any medicine like paracetamol or aspirin to such a victim. Next is sunburn. Sunburn is very common in areas where there is extreme heat, and it is a reddish kind of appearance which usually occurs over the body, and it is also known as sun poisoning. There is overexposure to sun rays in very hot weather. In winter or in high mountains also this can occur because of the ultraviolet radiations which are reflected over the snow peaks and can cause strong sunburn. So we should not say that only sunburn occurs in hot and humid climates, and it also can occur just like snow blindness. It is a kind of sun poisoning in the eyes. In the same way, this can also occur by the reflected rays. Recognition is done by skin becoming hot, red, swollen, itching at the site of the burn, and pain when rubbed or touched with blisters. What is the first aid that you will do in the case of sunburn? First of all, you have to monitor the area where the sunburn has occurred, and you have to shift the victim to a cool and a shady place. And it is very important that you loosen any kind of constrictive clothing, apply cool tap water over the area, apply soothing lotions like calamine or creams over the area. Sips of water can be given over regular intervals to hydrate, and if a large area is involved, you have to take medical help. It is also very common if you go on beach side or if you are visiting coastal areas, there because sun rays are very strong, and usually in those areas this sunburn is very common. So certain creams are available with good SPF whereby you can avoid it. But if it's not avoided, this is the first aid that you will do. What are the do's and don'ts? Most important is that you have to monitor the affected area properly, and if the victim becomes unresponsive, you have to but has breathing and pulse, you have to put him in recovery position. But if he becomes unresponsive, which does not occur in this case, you have to be ready to resuscitate. Do not give coffee and tea, and do not break any blisters. This is very common for all the heat as well as cold conditions. Please do not break any blisters if they are formed in any case of heat emergencies. Hypothermia or high body temperature is another kind of important heat emergency, where hyper means abnormally high, and it is very different from fever. In fever there is infection, but in hypothermia the body's temperature increases because the body is not able to lose the heat due to problem in the heat regulating system. These are the various causes. Already we have discussed them. Some causes are exposure to heat and humidity, overdressing, living in houses without proper ventilation, visiting high populated and crowded areas. Even in high fever you can have hypothermia, which is one of the sign and symptom. Impaired heat loss in the body, alcohol consumption. How you will recognize it? In early stages the symptoms are similar to heat exhaustion, and later on the symptoms are similar to heat stroke. So you can relate with those signs and symptoms and then recognize hypothermia. So, but you have to take care of the victim because his heat regulating system is not functioning properly, and for that proper assessment, resuscitation when required, fluids if he is conscious. These are the important things you have to take care of. And it is one of the symptom of infection also in the body, to what level it is growing. But if it is related to heat, excessive heat in the environment, you have to take care as similar to heat exhaustion and heat stroke, and please call for help if these things fail. Last is dehydration. We all know dehydration is actually heat related emergency also, and it is also one of the symptom caused as a result of heat related emergencies. So what happens is that when someone loses more fluid that they can take in, it is known as dehydration. It is a condition which occurs due to lack of fluid and salts which are necessary for the body. So whatever problems we discussed, heat cramps, heat exhaustion, heat stroke, hypothermia, the victim is at the risk of getting into dehydration. So what are the causes? As already you know, and some of which I will tell you are extreme heat or overexposure to sun, exertion, overexhaustion, not drinking enough water or salts, lot of sweating, diarrhea and vomiting. So how do you recognize dehydration? In adults, the adult will tell you he feels very thirsty. He has a dry mouth. There is a rapid breathing, rapid heartbeat. He will feel fatigued with headache, severe dizziness and lightheadedness, unconsciousness and delirium over the time. In many of the medical articles nowadays, they say that if you have a slight headache, it may be because you are not drinking enough water and you are dehydrated. So it is also one of the red flag, or it is also one of the important symptoms that you can see in a dehydrated victim. In the baby, usually how will you see, or in a child how will you see, is that there is lack of urine or lack of wet diapers over 6 to 8 hours. There is poor body turgor, poor skin turgor. If you pinch it, the pinch of the skin remains like this, does not go down. His eyes will be sunken. He will appear very, very lethargic. There will be dry skin, dry mouth, and the skin will be grayish in color. So these are the symptoms by which you can recognize dehydration in adults. dehydration in children. And in children, it is one of the important emergencies which you also have to take care of. So what is the first aid in dehydration? Obviously, give more and more fluids. Shift to cool and shady place. Ask to add ORS sachet and prepare the solution as per direction of the packet, and it is readily available at every store. If the symptoms appear, you have to take medical help. What are the do's? You have to start rehydration, that is ORS therapy, and fluids immediately as early as possible. Be alert for changes in response, vital signs, and be ready to resuscitate if required. What you don't have to do is to avoid giving coffee, tea, or alcohol, because these are the diuretics, and you don't want the victim to lose another amount of water.
In those extreme cold conditions, you will find that the victim or the casualty, we call in these situations, will have slow pulse rate and they will have slow breathing. But whereas if there are extreme conditions of heat, the casualty will have fast breathing, casualty have the fast pulse rate. So these are the distinguished features. The second thing which you have to remember is that whenever there is sweating, we said that in heat cramps and heat exhaustion, there is lot of sweating. It is mild sweating in heat cramps and more sweating in heat exhaustion. And this sweating here shows this defense mechanism. It is a sort of a defense mechanism, and the patient is saved when the patient is exposed to extreme conditions of heat, and when the first reaction, this reaction is a defense mechanism reaction, defensive reaction, that the body responds to the heat by sweating. That is very important, and that is normal in certain conditions. But as you have seen in sunburn and heat stroke, there is scanty sweating, and with the result that the heat injury is much more as compared to the other things. So these are very, very important things, and whenever there is nausea and vomiting, you have to restrict the feeds and fluids, and you have to check the responsiveness. If need be, in certain cases when the patient is responsive and the patient's legs can be elevated, but in certain cases when the patient is not responsive, you have to put him in recovery position. So because the positioning is one of the most important things that can act against the patient's care if we are not able to assess in what condition the patient is. So in certain cases, shock-like position is to be given so that the blood supply goes to the brain, and in other situations, recovery position has to be given so that the patient may not have more problems of this resuscitation. So thank you very much for this nice presentation, because this is the need of the hour, that everybody has to learn first aid in cold conditions and as well as the heat conditions. Thank you.
Thank you.